are living with a blood cancer or a blood disorder, finding the best way to treat the condition can be a challenge. Dr. Tony Castillos III from Personalized Hematology Oncology of Wake Forest is here to tell us why finding the right treatment for you is the key. And that's how your office separates itself from other offices, isn't it?
Yes, ma'am.
Tell me more about that. What makes your office different?
Well, the things that makes my office different in hematology is that I pretty much will look at if it's a cancer of the blood, or what they call a malignant hematology case, or if it's a non-malignant hematology case, and I separate those. And if it's a malignant hematology case, then it all depends on the cytogenetics, and it also depends on the molecular profile of the cancer in the blood. And my practice looks at the actual human genome of the cancer, and we're able to actually identify which pathways the cancer cells are dividing through, and then select molecularly targeted therapies that specifically target that particular cancer. Now, each person's cancer is often different. Cancers are heterogeneous, and blood cancers are even more heterogeneous, and it's dependent on the molecular profile or the cytogenetics of the cancer that determines how that cancer behaves in the human being.
What I think I'm getting out of this is there's no one-size-fits-all way of treating
That's correct.
A cancer.
So personalized hematology oncology looks at what is different about that particular person's cancer and what are the best drugs available for that patient's treatment.
And that's why having a personalized treatment plan is so important, right?
Yes, ma'am.
Let's talk about what you were just referring to, how your office can do these gene expressions and how that can really help someone get to the heart of the matter when it comes to a blood cancer.
Yes. For the last 40 or 50 years, we've been looking at clinical trials to try to determine what's the best treatment for patients. And those treatments look at individual drugs and whether those drugs are effective in a patient. And then if those drugs, particularly, for example, treat a leukemia or a lymphoma, then whether it has activity and how long it allows those patients to survive while they're taking those medicines. What the technology I utilize does is it actually, we take the RNA out of the cells, we extract them from the cells, and we hybridize it to a gene chip, and then we look at the 30,000 human genome set, and we can see which genes are upregulated, which genes are downregulated in the tumor cells, which drive the cells to proliferate or to divide and to grow. And by doing that, we can then use certain targeted drugs that will block those pathways and prevent the cells from dividing.
I would imagine this approach saves time and money because you're not doing a bunch of things trial and error. You know exactly what you're targeting.
That's correct. Oftentimes we would select therapies in the past that didn't allow us, or we didn't know whether it was going to work, and those patients would get those treatments, and in some patients the treatments would work very effectively, and other patients it wouldn't. For example, in clinical trials we may get a 40 or 50% response in terms of the tumors if it was a solid tumor shrinking in the patients. And then other patients, it wouldn't shrink at all. And so by actually looking at the blueprint of the cancer and seeing what it's doing, you can then select the correct therapies for the patient.
If someone's watching our program and they're interested in your approach, should they give your office a call?
Absolutely.
Okay, thank you so much.
Thank you.
If you have been diagnosed with a blood disorder or cancer and need the extra hand for your treatment, give Dr. Castillos a call. The number is 919-825-4637, or check out the website at wakeforest-personalized-hemonc.com.